Good morning. My name is Gary Owen. I'm the president of Owen Insurance Group, and today is October 9th, 2024, and we are sitting here in our facility, our training facility in downtown Stuart, Florida, on the eve of Hurricane Milton making landfall in the Tampa Bay, Florida area. So first of all, let me say our hearts and prayers go out to our agents and those of you that are residing in that area, in the Gulf Coast area, and Central Florida, and all the areas that will soon be impacted by this nefarious hurricane, unfortunately. So the reason why we're here this morning is that we have an urgent message that we want to get out to not only the residents of the Treasure Coast and not only the residents of Florida, but throughout the United States. So I think that there is a message of transparency that we want to convey, information and education. I want to introduce you, first of all, to Rob Gluckman. Rob Gluckman is the CEO, the owner of Treasure Coast Urgent Care. He owned Treasure Coast Primary Care and Live Healthy. So, Rob, thank you for joining us this morning. I wanted to bring Rob Gluckman in to get a second set of eyes because he has firsthand experience about this industry. But before we get there, Rob, tell us a little bit about you and your business and what got you into the medical field.
Sure, Gary. First of all, thank you for having me here.
Sure thing.
My wife is the only double board certified MD in both internal medicine and emergency medicine in all of South Florida. So we had the opportunity to purchase an urgent care. People loved her personality and her knowledge and said, hey, can you be my primary care physician? And she said, sure, because she had done that internal medicine residency. So eventually from that came Treasure Coast Primary Care, which we operated up until about 2 years ago, and we sold. We were the second largest primary care behind Cleveland Clinic here. And one of the reasons we got out was due to some changes in the Medicare Advantage plans, which I'm sure we're going to get to in a little bit. But we still operate the urgent care, and we've been blessed to, been awarded contracts with the Sheriff's Office, the county, and the city of Stuart as well. But we just enjoy taking care of and being proactive and providing the highest quality medical care because that saves costs and on the back end, not only for insurance companies, but for, patients.
High quality care. I mean, that's important. High quality service, high quality care, and high quality insurance plans. So, Rob, you're exactly right. We're going to get to that information. But let me first kind of set the tone about where we are going here this morning, because there's a lot of concern out there. A lot of seniors are scared. They're worried. Our phones are ringing off the hook. People are wanting to come in and review their plans because they're hearing all this gloom and doom about what's happening in the Medicare market, right, in the Medicare space. So there are a lot of changes happening for 2025. Let me say that. There are concerns, and if you have concerns, they are valid, related to Medicare for 2025. So we're going to get to that in just 1 second. Before we do, though, I think it's important that you know who we are as an agency. Owen Insurance Group, I've been in the industry for 18 years. I worked as an independent agent. I've worked as a captive agent. I worked as a carrier executive director for a national Medicare carrier. And then 7 years ago, I opened my own FMO or Medicare agency here on the Treasure Coast of Florida because I'm passionate about education. And that's going to be the theme of this morning's presentation is education and transparency. I think it's important. So if you're sitting there and you're concerned, know that we are here as a resource. Whether or not you do business with us, I want you to be able to have a place to go to get unbiased information and education about your Medicare. Because I always say, everywhere I go, Rob, I say the decisions you make today can last a lifetime. It's important to get it right the first time. So we're going to talk about what that means because the majority of Americans today think they're on one plan when they're on another. They think they can arbitrarily leave one plan and go to another guaranteed issue. So we're gonna kind of talk over that quickly, and then we're going to dive into some of the situations that Rob has experienced as a practitioner on the Medicare side, so you can hear from him, and you can also hear from some of the consumers on Medicare a Medicare Advantage versus a Medicare Supplement. I will tell you this. There is a major distinction between being on original Medicare with a Medicare Supplement or a Medigap plan. Those terms are interchangeable. Medigap, Medicare Supplement, one and the same, versus Medicare Advantage plans, which is managed care. People don't realize when you go on a managed care program with Medicare Advantage that you're opting out of original Medicare, and the carrier that you sign up with now is responsible to hopefully pay your claims. And I say hopefully because we're gonna read some articles. I took out of 20 articles I pulled this morning before Rob got here this morning, I chose 6 to kind of go over with some of you here. So Medicare Advantage. I think it's important to know that there are these following carriers have given us due notice that they are terminating some of their Medicare Advantage plans. Aetna, Humana, Florida Blue, WellCare, United Healthcare, Cigna, and Devoted. All of them in a local area here in Florida have notified not only us, but consumers who are on a Medicare Advantage plan. They received their ANOC notice that they're going to be terminated. Why is that important to you? Because it's important because now you have a guaranteed issue opportunity to move from managed care back to original supplement and pick up a Medicare, or back to original Medicare and pick up a supplement plan. So that's the advantage that those of you have who received that letter. So it's not all gloom and doom. It is a golden opportunity. I'd call it like the Willy Wonka chocolate factory golden ticket opportunity. So that's what you kind of have here this morning, is you have that opportunity to go from managed care to a supplement. Rob, your experience with folks coming to your practice who are on managed care with the Medicare Advantage plan, what were some of the situations you saw?
Well, the major ones were not being able to see the doctors that they wanted to see, right? So I'll let Gary explain the difference between the PPOs and the HMOs. But if you had an HMO plan, you were locked in to the doctors on that list, and they were not necessarily the best medical care, and it didn't really jive with our philosophy of getting the best possible medical care. Not having doctors that order multiple imaging and referrals to specialist friends to make sure that they made the right diagnosis. So every time you go to a specialist, you have a copay of some sort. So we always were cognizant of that. You know, we loved our seniors and we wanted to save them money, knowing most of them are on fixed incomes. So don't send them to specialists if you don't have to. Handle them in-house. But one of the other problems, in addition to not seeing the doctors that they wanted, was denials of referrals that we made for a particular imaging. We would get these things where we're denying it and we're going to have what's called a peer-to-peer, meaning they would have one of their doctors have to conference with one of our doctors to get a particular recommendation approved. It's just a way for them to take advantage of some of the lazier doctors that don't want to take the time.
Sure.
But it's also kind of a disingenuous, way for the insurance carriers to treat the doctors, because there's a shortage of primary care doctors now. So we can't see the patients that we want to see now anyway, but you're going to take them away from seeing a patient to go talk to one of your doctors about something that you should have authorized from the start. So I've read some articles. I'm actually an attorney by trade, so I, keep up on the medical legal aspect of things. I know there are some companies out in California that are now cutting down certain things that don't require prior auths, which should be across the board, and I would love to be involved in those conversations and tell them what they should stop.
I think we're going to see some of that. I know that the government and CMS is looking to kind of curtail the denials of pre-authorizations moving forward. We'll talk about that as well. But again, before we go into some of these articles that we pulled this morning, it's important that you hear not only from us, but it's also important that you hear from providers, from hospitals, and from consumers who are already on a Medicare Advantage plan and some of the obstacles and concerns that they have. So understand that if you're on a Medicare Advantage plan and you're not happy with that plan during the annual enrollment period from October 15th through December 7th, you can change your plan. You can go to another Medicare Advantage plan. You can drop that Medicare Advantage plan, go back to original Medicare, and then see if you qualify to go into a Medicare supplement plan. Yes, you have to qualify. You can't, it's not like Medicare Advantage where you just arbitrarily go in from one plan to another. So this is what people don't realize. Now, especially, and the majority of states do require you have to go through health underwriting to qualify to go to a supplement plan, typically after age 66, because you have, at age 65, if you enroll in Medicare, and the first time you enroll in a Medicare Advantage plan, you have a trial right period, 12 months, to test drive your Medicare Advantage plan and go back to original Medicare, and then pick up a supplement guaranteed issue. But after age 66, Rob, all bets are off. Now they have to answer health underwriting questions, and if you have a certain pre-existing conditions, that could disqualify you from enrolling in a Medicare supplement plan. So with original Medicare and a supplement plan, you have no networks. You have very little restrictions, and you can budget what your health care costs are going to be throughout the year. Medicare Advantage is a little bit different. So you still have, even though many plans are zero premium today, Rob, we were notified yesterday of certain companies here in the state of Florida who are now charging premiums for the Medicare Advantage plan, which have been traditionally zero premium. One company is charging $125 a month for their Medicare Advantage plan, which
they're going backwards.
I'm going to bite my tongue. I'm not going to say anything about that, but I'm like, why would you do that when you can enroll in Medicare and pick up a supplement plan for maybe $50 to $100 more, and even less, depending on some supplement plans? So the key word today, if you take nothing out of today, is education. Let us be a resource. If you have questions, you can call my office at 772-210-1020. We have over 500 agents across the state of Florida and other states that are available and ready and willing to take your call and to talk to you. So can you, Rob, kind of explain why you prefer to work with companies or patients that have original Medicare with a supplement versus managed care? Why is that important to you?
We don't generally get the pushback from Medicare. They trust the physicians on their panel to do the right thing.
Right.
And, you can speak better to it, but the 80-20, what they're responsible for is a lower cost, typically across the board for our patients, which we're cognizant of. We want to take care of. And Gary, I kind of wanted to interject when you were speaking, but I didn't want to cut you off. But I think you kind of hit the nail on the head with, we need ethical, professional, knowledgeable insurance agents to answer these questions. And
Yes,
Gary, I know your reputation, is beyond reproach, and you're not going to push somebody in a particular way, but unfortunately there are some agents out there that will push you towards a plan and sell you this pot of gold,
right,
and it turns out to be a pot of brass.
Yeah.
So
that's true. I mean, we always talk to our clients. Again, transparency being the key word. I let them know what we make in commissions. I have nothing to hide. Now, my competitors may not like that. So historically, Medicare Advantage plans will pay agents higher commissions than what Medicare supplement commissions pay. So historically, if a client's turning 65, that agent is going to make about $626 in commission. Whereas if you write a Medicare supplement plan, that agent may only make half of that amount. So that is a distinct difference between what agents can make on an Advantage plan versus supplement. And there are captive agents. So I always tell my clients, listen, whether or not you do business with us, that's totally up to you. We hope that you do. But make sure that you grill the agent that you're looking to work with. How long they've been in the business. What other qualifications do they have? How many clients do they have? Are they captive or are they independent? Captive meaning they only represent that one carrier in those plans without carrier, or are they independent representing multiple carriers, giving you, the consumer, more choices? Also, make sure that you find out how have they had any complaints made against them. So don't be afraid to interview your prospective agent. And I'll tell you, this industry, typically 93% of agents fail in this industry within the first 2 years. So there is a high attrition rate. So again, don't be afraid to ask how long that agent has been in the industry.
And Gary, that transitions into the medical as well. Do not be afraid to question your doctor before you choose them. If they don't want to talk to you, they're probably not somebody you want to use. Look at all the reviews. Don't look at just Google reviews or put something on Facebook and say, hey, who do you like? It's a very individual choice. And of course, some people may like a doctor because they're a great person. I'd love to hang out with them, but they don't understand that they don't have the fund of knowledge that somebody else might have.
And then, Rob, you'd mentioned HMO, PPO. So HMO are health maintenance organizations, PPO, preferred provider organizations. More flexibility, of course, on PPOs. But again, you still, with HMOs, you have less flexibility. You can't go outside the networks. And there are some networks that are really skinny on HMO plans. So it causes a lot of problems and consternation with Medicare beneficiaries. PPOs, you may have more flexibility. But then there may be doctors who may not take Medicare Advantage plans, or even they're out of network. They may not want to take it. So these are the problems that we see that the consumers have. But real quick though, the first article comes from Becker's Hospital CFO report. And again, if anybody wants copies of these, if you think I'm making this up, you're more than welcome to contact my office, and we'll be happy to forward you some of these. But the first one comes from Becker's Hospital CFO report that says hospitals are dropping Medicare Advantage left and right. Why is that? We know that Medicare Advantage provides health coverage to more than half of the nation's seniors, but a growing number of hospitals and health systems nationwide are pushing back and dropping these private plans altogether. Among the most commonly cited reasons are excessive prior authorization denial rates and slow payments from insurers. Some systems have noted that most MA carriers have faced allegations of billing fraud. Of course, this happens quite frequently in the Medicare Advantage space from the federal government and are being probed by lawmakers over their high denial rates. It's become a game of delay, deny, and not pay, says Chris Van Gorder, president and CEO of San Diego-based Scripps Health. Locally here, Rob, we know Cleveland Clinic is in negotiations yet again with United Healthcare. Right. So we don't know what's going to happen. We think we may know. But then there are consumers who are on the edge, worried and concerned, have to go through this all the time. You don't have to worry about that and go through that if you are on a Medicare supplement plan. Understand that.
And think about that, Gary. If you're at a primary care or a specialist and they say, listen, you are, critically ill, you need to go to the hospital. The first thing you're thinking about is your health, not am I going to be able to pay for this? You expect the hospital to be able to get compensated and not expect a big bill at the end.
That's right.
And,
That's right.
The doctors are not going to know what your plan, what hospital is credentialed with your plan. So you really want to play the odds and find one that has a high majority, if not all. I believe Medicare is with 99.9% of hospitals.
Yeah, about 98.5% that accept Medicare. And by the way, let me go on record right now and say Medicare Advantage has its place. Listen, we're not demonizing Medicare Advantage. We're just bringing it to your attention to understand the limitations that we currently see. We're hopeful that the government's going to turn around some of these issues that Medicare Advantage has. I'm hopeful. I think it's going to happen eventually. But in the meantime, consumers are facing the brunt of this, and they're the ones who are going to be terminated. Many of you have already had your termination letter in the mail. And again, as I said before, it is your golden opportunity to leave managed care if you so choose. You may say, hey, I like it. I want to stay here. That's great. There are other Medicare Advantage carriers and plans that may be better than what you currently have. That's why we say, Rob, it's always good to have a review done every year during the annual election period because plans change, benefits change, formularies change, premiums can go up, they can change. So if you sit there with your head in the sand like an ostrich and do nothing, you're going to pay the consequences for that decision.
And another thing, Gary, when you meet with your clients, I'm sure you tell them everything, but again, to Gary's point that, the Medicare Advantage plans are not the devil. We're not here to say don't sign up for them, but just know what you get and what you don't get. I remember some plans having like free transportation for people that didn't have licenses because of eyesight or whatever, and they relied on that benefit to come see their doctors, which is great. But if that benefit's taken away the next year and you don't know about it,
exactly.
We really put the onus on the insurance agents to, educate the patients and let them know, hey, if this is an important benefit to you, you might want to look at this carrier because the carrier you're currently with is not carrying it.
Yeah, and to Rob's point, I mean, there are major changes with a lot of these Medicare Advantage plans. Benefits are being clawed back, and you're going to see here in just a second. But listen, Medicare Supplement's not going to be for everybody. Just like Medicare Advantage is not going to be for everybody. There is not a one-size-fits-all solution when it comes to Medicare insurance planning. So if you think there is, and that's what you're used to, then you definitely need to give Owen Insurance Group a call and speak to one of our licensed professionals to help guide you, be your unbiased guide, and to help educate you about the choices you have, right? Number 2, this says hospitals, from Nathan Eddy, hospitals confront mounting reimbursement challenges and diminishing cash reserves. Revenue reductions linked to Medicare Advantage denials surged by 56%. That's no bueno. No bueno. Escalating reimbursement delays and declining cash reserves are placing hospitals and health systems across the nation in a precarious financial predicament, according to data from Centellus Performance Solution analysis of over 1,300 hospitals. The HAFA, which is the Healthcare Financial Management Association, says nearly half of health systems are considering dropping Medicare Advantage plans. This article was written by Andrew Cass. There was a survey conducted of 135 CFOs conducted in January. 16% of health systems are planning to stop accepting one or more Medicare Advantage plans in the next 2 years. Another 45% said they are considering the same, but haven't made a final decision. So health systems have been increasingly pushing back on Medicare Advantage. And again, it has become a game of delay, deny, and not pay. So that's number 3. Number 4, this is from Newsweek. Millions could lose Medicare Advantage benefits. Susan Blake wrote this back in May. After Humana announced it would be cutting Medicare Advantage plans by 2025, seniors have been panicked, wondering how it will affect their health care coverage. You should be panicked. You should be concerned. You should be picking up your phone and calling our number so we can give you unbiased information. Let one of our agents be your guide. 6 million Americans are insured through Humana's Medicare Advantage. Not all states are equally affected by the cuts. Humana offers Medicare Advantage in all 50 states, mostly focused on the Southeast. According to recent Humana coverage data, these are the top 5 states most likely to be affected. Guess which state's number 1?
I'm going to go with Florida, Gary.
Bing, bing, bing. Florida number 1 at 743,000 policyholders will be cut or terminated. North Carolina is next at 457,000, Georgia 337,000, Texas 290,000, and Illinois 256,000.
And if it affects that many policyholders, it obviously also means that the physicians are going to be impacted.
100%.
Well.
And this is just Humana. This is not Aetna, Florida Blue, WellCare, Cigna, Devoted. So all these carriers are the same thing is happening for 2025. I did for my nonprofit, I also run a nonprofit called MedicareJourney.org, and we talked about Medicare mayhem. So there is going to be Medicare mayhem, especially for those of you who are doing nothing, right? So this is an opportunity for you to do something, to make a change that's going to be beneficial for you, for your health, for your peace of mind, and also for your pocketbook if you care about budgeting your medical expenses. And Rob, do you feel that consumers are going to pay more or less in medical out-of-pocket expenses for their health care needs as they get older?
Oh, absolutely more.
Absolutely more.
The cost of goods goes up, new medications that come out that may not be, $10 copay type things that they used to be. Yeah. Now they're $75, $100, $200. The older you get, the more chronic diseases you have, the more medications you may be on, the more specialists you may be in. It's not going to go down. It's only going to go up.
Yeah, we have a lot of clients, and I remember a couple of them come to us and said, Gary, we love what you guys do. We love the the information and the education you provide. I love my Medicare supplement plan because it provides me the freedom and the flexibility to be able to choose to go to any doctor, any specialist, any hospital that I want to go to. That's powerful, right? To have that freedom and the flexibility, being on original Medicare with a Medicare supplement plan. The next one comes from Forbes. Why Medicare Advantage plans are likely to be squeezed next year with reduced benefits by Bob Carlson. He's the senior contributor. Even though Medicare Advantage plans are popular, they're estimated by the Kaiser Family Foundation to have enrolled more than half of Medicare beneficiaries for the first time this year. So Medicare, historically, it's been original Medicare with a supplement that has been in the forefront of Medicare plans. Now Medicare Advantage, as of 2024, is taking the lead on enrollments. But he says changes are underway. Those enrolled in Medicare Advantage plans or considering them need to pay careful attention when evaluating plans in this fall's, what did I just say?
Pay careful attention.
Pay careful attention during the annual election period. There could be significant modifications to existing Advantage plans. There not could be, there will be. He's being nice.
Right.
Medicare Advantage plans are popular for relatively healthy beneficiaries. Healthy beneficiaries. Out-of-pocket costs usually are lower than for a package of original Medicare coupled with Medicare supplement insurance. Also, the CEO is going to hate me, Rob. Advantage plans are popular with insurers offering them because they're very profitable. So you probably don't know this. I have Humana, United Healthcare CEO, CVS, Elevance CEO, and Cigna CEO. How much money, Rob, do you think that these CEOs make a year? Give me a rough estimate.
$5 million.
$5 million. So, Humana, 17 CEO, has made $17 million last year. Close to what you're making. Close. Close cigar. United Healthcare CEO, $24 million. CVS and Elevance, $22 million, and Cigna CEO, $21 million. Wow, that's a lot of freaking money, Rob.
Does that also include the bonuses, the year-end bonuses?
No, this is their salary. You guys get the picture. I think you're starting to get the broad picture here. But anyway, government policymakers continue to revise the program to reduce spending on Medicare, and especially with Medicare Advantage plans. Reduced payments to Medicare Advantage sponsors are likely to cause changes in plans for 2025, like I've said, and like I've reiterated, such as higher premiums, co-payments, deductibles, and reduced coverage. In fact, as I said before, one Medicare Advantage carrier is charging now $125 for their plan a month on top of your Part B premium, and a lot of clawbacks. Some of the out-of-pocket maximums have gone from $4,900 to $9,100 out of pocket. So understand that zero premium does not equate to zero cost. So understand that, because yes, we get that people love their MAPD plans because they're not paying a premium for it, and some have a give back of the Part B premium. But when it's time to pay the piper and you've got to pay that out-of-pocket maximum of $9,100, you're probably going to wish to God that you were on original Medicare with a supplement plan. I'm just saying.
Patients are always going to have skin in the game. Before insurance wants to shell out their part,
right,
you've got to shell out your part. It's been that way for quite some time, but a jump from $4,000 to $9,000 is just insane.
It's a shame to see what's happening. In fact, some of the carriers, and this has nothing to do with consumers, but there are a couple carriers who are no longer paying commissions for our hardworking insurance agents who spend time going through the Part D drug, and that's the most important part of Medicare that we see from our clients, is getting the drug plan and getting the formulary correct for these consumers. And now two carriers are no longer paying the agents for their hard work in doing this stuff. And one carrier, in fact, is taking away all renewals from all the agents nationwide. So there are some pain points that not only our consumers are facing with Medicare Advantage, but also, and Part D, but also agents and agencies as well. And then finally, number 6, Matt Cunningham Cook from Jacobin writes, Medicare Advantage insurers are making bank by denying care to seniors. There was a lady by the name of Jen Coffey. She was so tired of having her care denied by her Medicare Advantage insurer that she considered signing a do not resuscitate order, Rob. What a place to be. What a place to be on a Medicare plan.
That it's unfathomable in these days. But, Gary, to the point from, my personal experience is the denials are basically based statistically on doctors being lazy or not having the time to go through with what are called peer-to-peers. So when they deny things, they will question our doctor as to why is it truly necessary. Well, insurance companies know that we have a drastic need and a shortage of primary care physicians. Why are you taking them out of the room to see more patients to then have a discussion with your physician to approve something from the doctor that you trust to have on their list in the first place? Doesn't make any sense.
So going back to Jen's story, she said there was no more hope. There was nothing left for me to hope for. Coffey was a former EMT. When she went on Medicare, she had breast cancer. A diagnosis left her unable to work. Like an increasing number of Medicare beneficiaries, she ended up for a Medicare Advantage plan. I won't mention the carrier's name. I probably should, but I will not. But this insurance carrier is a $450 billion insurer. Instead of finding the program relief, Coffey says that this Medicare Advantage plan insurer constantly rejected or second-guessed the care options her doctor suggested for her cancer recovery and for a rare and painful secondary disease that had no standard treatment plan. There are a lot of ways that they deny stuff that you need, she said. And so many times that I had the opportunity to try different treatments and medications, the response was, they will not cover.
So, Gary, as barbaric as it sounds or, macabre as it is, especially in cancer patients, because the cancer medications are so expensive that they're going to gamble, okay, if we deny it, well, maybe they will expire before we need to pay for these meds. And that's insane.
It is. It's gut-wrenching. It really is. And I have my own personal stories to share. But I'm not going to take the time to do that today. Not that it really matters much anyway. I think most people here that are seeing this, I kind of get what we're doing here and understand that you have an opportunity. Make sure that you know what you have. If you're not getting what you want, where you need more transparency, more understanding, again, feel free to use Owen Insurance Group as a resource, because we're all standing by and we're ready to help and support you and provide the information that you need. And then the last person is Rick Simmons, 75-year-old retired veteran. He discovered a small lump on his ear, which ended up turning to be cancerous, and he was on a Medicare Advantage plan. Unlike traditional Medicare, Medicare Advantage plans are based around provider networks that force patients to choose health care providers selected by the insurance company, or else they face potentially enormous financial penalties. This meant that rather than getting the best care from the most experienced doctors that you alluded to earlier, Rob, of his choice, Timmons' plan outsourced its claims processing and determinations to a health services company. And then this company gave Timmons a runaround, turning a minor diagnosis into a serious health problem. He would call every week, and the customer service agents would say that they were having problems. He said this lump tripled in size. It was painful. It became a malignant melanoma, and it was very aggressive. It was 7 months had gone by before he was finally treated. Timmons says, I'm stuck. I can't change to another Medicare Advantage plan at this stage now. I can't go back to traditional Medicare because there's no way that they would accept me for a Medigap plan. Because of the cancer diagnosis, so it would be outrageously expensive. So I feel like I am trapped. So going back to what I said earlier, understand the difference between managed care with Medicare Advantage, which is Plan C, versus staying on original Medicare and picking up a Medigap plan and despite of what you might hear about how costly they are, there are some plans here in the state of Florida that are as low as $50 a month. Outside of the state of Florida and other states, they could be as low as $30 a month. For a Medicare supplement plan, less than the cost of a Medicare Advantage plan and half of the MOOP, or the maximum out of pocket of Medicare Advantage plans. So understand that you do have options, especially if you're carrying the golden ticket, that ANOC letter that has terminated your plan. Now you have the guaranteed issue right to go into a Medicare supplement plan, no health questions. So if you do have questions, speaking of questions, you do have questions, feel free to give us a call. Rob, what are your final thoughts that you'd like to convey?
Just do your homework. Like I appreciate you asking me to come on the show to help educate, and that's what this is all about: is be an advocate for yourself. Talk to your agent, ask the hard questions, talk to your doctor, ask the hard questions, get educated for yourself, and make the best possible decision for what's right for you.
Exactly. We don't always have all the answers to 100% of the questions. Most of them we do, but if we don't have the answer, I guarantee you that we are not going to make it up. We're going to find the right answer for you, no matter how painstaking it may be. So understand that you have an agency here that's been on the Georgia coast for 38 years. I've been on the Georgia coast for 38 years. We are absolutely committed to your quality of life and ensuring that you are properly educated so you can make the most informed decisions for your health care today and in the future. And finally, let me say this, and I'll say it one more time, and we'll close with this. The decisions you make today can last a lifetime. It's important to get it right the first time. Thanks for watching, everybody. You all stay safe out there and have a very great Medicare AEP season. For those of you who need help, remember, we're here for you. Take care.